This is Ted, our good friend.
Yeah, I think we'll take him. I think we'll
We'll
go.
take him. All right, let's do it.
Hey, Ted, how are you from Washington? You say trans care believes, deserves, but not gender medicine. I do not understand. Could you please explain?
Hey guys. Yeah, so I believe that we should help trans people with therapy and support, but I don't believe in the medicine like puberty blockers, cross-sex hormones, and surgeries.
Okay. What do you, so can you explain to me what puberty blockers do to the human body?
They block the release of hormones, right? Like pubescent hormones. I think the drug is called Lupron.
It's
Yeah,
one
tell
of
me,
the
tell me, tell
brands.
me tell me the mechanism. Like exactly how does it do that, and what effects can you expect?
Yeah.
I don't know how it does it, but obviously it stunts growth and it can cause bone development
Wait.
problems. And
So it sounds like Ted. So it sounds like you don't understand the medication, yet you think I should care what you believe about a medication and how it should or should not be used. Is that what I'm getting?
well, people have looked into this. There's a global retreat from
Right, Ted.
right now.
Who are people? Who are these people that you're talking about? What are you citing here?
I'm citing the CAS report from the NHS, Finland, Norway.
Okay, so that tells me a
25
lot of what
American
I need to
states.
know. So the CAS report has been thoroughly debunked. But I can tell you here. Number one, it's kind of silly that you're gonna say that you, a person who does not understand the medication or what it does, that you should have any say in somebody else's healthcare. Do you think that we should take your opinion over the opinion of like the American Academy of Pediatrics, the AAFP, the AMA, the ACP, et cetera, et cetera? Why should I care about your opinion on this?
Well, the Health and Human Services just released like a document,
Right, the Health and
comprehensive
Human
review, and there's
Services is now run by somebody who thinks vaccines are evil and who literally like swam in a river that's like polluted with like excrement
Human
and lots of other
sewage.
human sewage. Do you like do you understand that maybe they're not the best people to listen to as far as like what they are saying right now is not necessarily evidence based?
I think there's a broad coalition of people. So you might not like RFK, but there's
Right.
CAS
Who
report,
the
there's
broad
Brazil,
coalition of
there's
people
Norway.
that are not. So are those people that you're talking about, are they pediatricians? Are they family physicians? Are they physicians of any type? Do they practice medicine? Do they have a license to practice medicine?
Dr. Hillary Cass does.
Hillary
Okay.
Cass is not in the US for one. And not
Ted,
somebody. So yeah,
go
go
ahead.
for it.
I was just going to ask Ted a question really fast about, so is there anything that like Dr. Ben can tell you as a trained physician and we've explained many times, is there anything that we can tell you that's going to change your opinion on the fact that puberty blockers are actually healthy or actually fine when monitored by healthcare professionals?
Well, actually, I would agree with that. They are fine when used for the right reasons, like precocious puberty, but I don't think they should be given to.
What again? So here's my question.
Yeah.
Why should I give a fuck about who you think should or should not get treatment with certain medications?
But
Well, it's not my opinion.
Well, Ted,
First
off, let's use logic here. I'm just going to use flat logic. So you think that puberty blockers are okay for precocious puberty, which is given to children younger than the children that are getting it for transition-related healthcare and are on it for longer than children that are on transition-related healthcare. Why is it healthy for them when they're on the medication longer than the person that is doing it for transition-related healthcare?
Because in transition-related healthcare, they're leading them towards cross-sex hormones, which will sterilize the patient.
Not necessarily.
No, that's not true.
No. And again, this is showing that you are talking out of your ass about something that you do not understand, and that pisses me off. So here's the thing. The puberty blocker, it's more of a pauser. It does not stop your puberty forever. It pauses it so you have enough time to do whatever the next thing is. For a lot of people, yes, they do end up on cross-sex hormone therapy because most of the time, according to the data, most of the time people who come out as trans at that young age stay trans. Like they do not desist into their adolescence and into their adulthood. But there are plenty of people who start on puberty blockers that don't want to go forward with medical transition and will come off of those. The reason why we use a puberty blocker at those ages is so that people have time to decide whether or not they want to do something that is more permanent, or if they want to go through their own puberty, or we can use it for other reasons, such as precocious puberty. We can use it for menstrual suppression. We can use it to help use cross-sex hormone therapy at an appropriate rate for their age. Like, it's not something that is an absolute, like, you're going on puberty blockers, therefore you're going to start hormone therapy. You cannot make that argument. So if you're going to oppose puberty blockers, you have to oppose them on a reason other than what the side effects are for cross-sex hormone therapy. So in isolation, so just talking about puberty blockers, why are you opposed to those? Like, going back to Josie's question, why are you opposed to those for trans people and not for cis people with precocious puberty?
Because I think, like, what I call trans people, I think is just gender nonconformity. So I think people are better off just being men who aren't conforming to the standards of their
should
genders.
people
I don't think that
so regardless, and you have every right to think what you do, but does your opinion get to determine what somebody else does with their body?
I think we should protect. I agree with you. For adults, they can do what they want. You have the right to do that, but kids should not be subjected to this.
Do you think that children are the only ones making this decision for themselves, or do you think that there's, I can't remember if you were one of the people I went over the whole process with, but you know that there's a whole team of professionals along with the kid's parents and the kid that get to decide what all goes into that person's healthcare. And the minors that end up going through these treatments earlier are often the highest risk if they don't get access to these.
But it doesn't matter how many people are involved.
It's not an informed consent issue with minors. It's not, but here's the thing. Regardless of what your opinion is, if there's a team of experts that have determined that for this minor, the most safe course of action is to allow them to transition, do you think that you should be allowed to make medical decisions for other people's children?
It doesn't matter how many people are in the decision, because, like, let's say there's a bunch of people.
But it matters. But it matters.
A child
Ted,
marriage.
Ted, you are not an expert, though, correct? Ted, you are not an expert in medicine, right? Do you have a license to practice medicine?
No, I don't. But Dr. Cass does.
So,
okay,
I don't care what Dr. Cass says. If you have a team of pediatric endocrinology, general pediatrics, adolescent medicine, psychiatry, and the kid's parents and the kid, if you have all of them on the same page, so we're talking I'm not just appealing to the number of people who agree. I'm appealing to people who are accountable and responsible and held to a legal standard, held to a professional standard to provide the best care for that person. Those people are the ones making that call. And you bear no responsibility in this decision, so you have no business making that decision for somebody else's kid.
So Ted, I also want to say this. If I said Dr. Fauci said you need to get a vaccine, would that change your mind at all? Why are you doing the same thing with Dr. Cass?
Because Dr. Cass isn't saying you have to do this. Dr. Cass is saying this shouldn't be an option.
So
Dr. Fauci
you're
would be
okay
recommending you to get the vaccine.
And so you're saying that all these liberals out there that have been saying Dr. Fauci says this is the best thing to do, you're like, oh yeah, you know what? He's a doctor. So yeah, I guess that's right.
Well, I haven't looked into that. I'm kind of neutral on that.
Oh, but no, but seriously though, like, okay, so you're not looking into it. What if I say I haven't looked into Dr. Cass? I don't give a fuck what she says.
Well, it's not just Dr. Cass.
How is that an argument? How are you trying
Finland.
to make
It's
me
a
appeal to
global
authority?
retreat.
Why are you trying to make me appeal to authority of Dr. Cass when we do the same thing with more doctors, more evidence, and everything like that? We need to just throw out that argument altogether, because at this point, the conversation that we were having was essentially, okay, puberty blockers, and you say it causes harm and damage and all this type of stuff, and you're like, kids can't make the decision. We're all over the place, Ted. Right. And so for me, it's like, I wish you would grant us a little bit of intellectual honesty when you're saying, but Dr. Cass, though, it's like, is that any different than saying any doctor, anytime, for any argument ever? That doesn't make any sense. It's a silly appeal to authority to try to convince us that we should stop medically necessary healthcare for children that have been getting these benefits and have been their lives have been saved. So my question to you, I have a question for you. You said that children don't understand and can't understand gender. Is that what you said? I just want to verify.
Yeah, well, I've actually said I don't believe in gender, so I don't think anyone understands it.
Okay, but regardless of what you said, I'm asking you the question, do you believe that a child cannot understand gender? I don't care about your opinion on gender because that's irrelevant. Okay, great. Do you believe that pediatric psychologists have a profession that exists?
Yes.
Do you see that they have value in society? Do you think pediatric psychology should exist as a profession?
They can get stuff wrong. Like, a lot of people think this is like the lobotomies of the past.
So any doctor can get anything wrong. That's silly to appeal to the one exception to the rule. Overall, generally, the practice of pediatric psychology is a good thing. Yes or no?
Neutral. I don't know.
You're neutral,
and Ted.
Science.
And Ted,
that's squirrely at best.
And the body of experts that, sure, people can get things wrong sometimes, but the body of experts, people who have trained like their entire lives to make decisions like this for people and make recommendations, they are far less likely to get it wrong consistently compared to you who have zero qualifications. So sure, you can say that, well, they got things wrong sometimes. Would you rather, if we were going to space tomorrow, would you rather trust somebody from NASA with expertise to build the rocket, or would you trust yourself to do it? Clearly, one of these is more knowledgeable and more up to speed than the other person with regard to this. So
yeah. And Ted, I just want to say this. The reason I'm asking you the line of question about pediatric psychology is because pediatric psychologists are trained in understanding what is a kid making up a story and using their imagination versus real world trauma. So when a child, heaven forbid, goes in for abuse, the pediatric psychologist has to be able to have a conversation with that child to realize what is real, what is not, what is harming the child, who is harming the child. And we use those type of records for courts of law for custody. We use those records in courts of law for a lot of different things because those experts know what they're saying. So people can't go on the stand and say, oh, this pediatric psychologist doesn't know what he's talking about. My kid's just making up the story about A, B, and C. No, we have a system of experts that are understanding of children's psychology to be able to decipher what is real and what is not real. So when you say, oh, gender dysphoria is just gender nonconformity, guess what? There's already a system in place that pediatric psychologists follow to know the difference between somebody who's exploring their identities versus somebody who has diagnosable gender dysphoria. Gender dysphoria is consistent, insistent, and persistent. Is a diagnosis that has to be given for over a year before medication is even given to a child. So the reality is, the reason that there is such a low regret rate and such a low detransition rate is because the pediatric psychologists have put such a heavy burden of proof of clinical diagnosis of gender dysphoria before people even see this healthcare. We're talking about maybe 400 kids a year, maybe max, that are getting this type of healthcare. So when you have, and if you block this type of healthcare, guess what ends up happening? Let's say they're a trans boy and they start developing breast, and then they start binding and they start hurting themselves because they're binding too tight because their spine is still growing, but you can't stop them from binding because that's what they're going to do, because you can't police them 24/7. So now you're on the conversation about, oh, let's give a 16-year-old breast or chest surgery, chest reconstruction. So what is it? Do you prefer that a person go under the knife and go through a very complex surgical care, or would you rather them take a pill or a shot to give them the proper bodies that they would feel comfortable in that requires less surgical intervention? What is your choice? Because they're going to do one or the other.
You guys aren't trans medicalists, right? So what would be wrong with them just living as their gender identity and not going through the medicine?
They can if they want to. If this is a bodily autonomy issue, and it's also a harm reduction issue, like Josie is saying. Like, if you have a high risk kid that basically at the end of the day, either they're going to medically transition or they're probably going to be hospitalized for issues most likely related to how other people treat them. Or you might end up with a very high suicide risk. And it comes down to, would you rather minors have access to evidence-based gender-affirming care, or would you want more of them dead? That's honestly what this discussion is about.
Well, the evidence is split, and I know you guys say that the regret rate is low, but
do not dodge the question.
Yeah, answer the question first.
Evidence is not, and the evidence is not split because you've already cited thoroughly debunked. You've already cited thoroughly debunked studies. The CAS report is not
you guys cited the debunked. You guys cited the debunked.
The question I asked you,
Dr. Maya Deakins.
No, Ted. Yeah. If the majority of these minors that are getting gender-affirming medicine are higher risk, at the end of the day, this comes down to a harm reduction issue. Would you rather trans children have access to gender-affirming care, or would you rather more of them be dead?
I reject that gender-affirming care actually lowers suicide risk. I think that's been
what's your evidence other than CAS?
You guys,
what is your evidence? Because this is
regret rate.
Ted, this is the gold standard of care.
1% regret rate.
This is Ted. You've already admitted that you don't really know anything about this issue. The American Academy of Pediatrics endorses this medical management of gender dysphoria in minors. The American Academy of Child and Adolescent Psychiatry also endorses this. The AAFP endorses this. The ACP endorses this. We have actual bodies of experts that agree that harm reduction is maximized through this management. If you are going to disagree with all of these medical organizations and with current medical guidelines, you have to bring extraordinary data. You have to really knock it out of the park with your citations. And you know what? If you have that data, you can take it to the AAP. You can take it to the AAFP.
Okay.
What is your data?
Can I share something with you guys? So you guys said that the regret rate was 1%, but Dr. Amaya Deakins, who's with WPATH, I don't know if you guys know the World Professional Association for Transgender Health, she admitted on Twitter that the regret rate is about 30%. She said that.
That is not true.
January of 2020.
That is not true. Ted, your citation is that somebody tweeted a thing. That's
somebody
your citation.
Who's an advocate.
I don't
somebody
care.
Who agrees with you guys.
I don't care. Ted, what is a? Do you know how to cite legitimate data? Do you know how to give any citation at all? do you have any validated research studies?
I don't have it
You
on
have
the
clinical
other stuff, but I'm
guidelines
telling
to
you about
talk about.
Dr. Amaya Deacon.
You're talking about somebody, Ted. You are appealing to authority of someone who tweeted a thing on the internet. Do you understand that a tweet maybe is not the best evidence to cite?
Well, why do you guys say it's 1% when WPATH itself is saying 30%?
That WPATH itself did not say that.
No, that was a person that you said is affiliated with WPATH. That is not the stance of WPATH. So stop. If I said something, if I tweeted something, that does not mean that it is the stance of the line, right? So Ted, you need to seriously look at what information you're pulling, how you're obtaining that information, who's saying that information. Is it the official stance of something? Because we are talking leagues of difference of evidence.
Yeah.
Right.
So Ted, I want to give you an example.
Well, I think
so. I ran the U.S. transgender survey back in 2022, where we surveyed over 92,000 trans and non-binary people across the United States, every state, every territory, and even bases overseas where trans people resided. And we were able to ask the question about, is your quality of life better since you've come out as trans? And 97% said yes. And also, the other question we ask is your life more satisfied after you receive gender affirming care? 98% said yes. Now, and then we ask the question, if you had surgical care, is your quality of life better since you've gotten that care, that surgical care? And 99% said yes. So at the end of the day, I have an entire scientific data set of 92,000 trans people across the United States. And guess what? It shows the 1% number yet again. And so why am I able to do a repeat of the data that already existed through clinical studies that say it was 1% regret rate and detransition rate, and then I was able to observe the same trend in a completely different study that I was able to do at 92,000 respondents? How was I able to get that 1% number again? That's what science is. It's repeatable. I can say, okay, is this the number?
1% is too much. Even one person regretting it is too much. Listen to Chloe
So
Cole,
we shouldn't do heart surgery?
Clementine Breen.
Should
listen to Richie Herron. These people were mutilated.
Ted, shut the fuck up, Ted. What's the regret rate of a knee replacement?
That's not the same thing. That's not an elective surgery.
The reason why I'm asking, the reason why I'm saying this, Ted, the reason why I'm fucking saying this to you is because you, for some reason, think that you're some kind of medical expert that can make decisions about what is too high of a regret rate and what isn't.
Yeah,
it's putting things into perspective. Because you're saying,
listen to these stories
because is the of pregnancy.
Yeah, what is the regret rate of pregnancy, Ted?
Listen to the stories of these kids who were mutilated.
Ted, answer my fucking question, or I'm dropping your call. You're seriously annoying.
I don't know the regret rate.
You don't know. Do you know why that matters? Because again, you are trying to talk about what is too high of a regret rate and saying that should be the opinion of everybody and how we should regulate healthcare for people. You're not qualified to make these decisions. You're not qualified to weigh in on this. So kindly shut the fuck up or get actual evidence to prove your point. Because Ted, 1% regret rate is incredibly low. Incredibly low.
You're saying one person, Ted. Tell me another thing you hold the same level of standard that you hold medical transitional healthcare. So you say one is too many. Give me another example outside of trans stuff.
I view any unnecessary intervention that has lifelong complications the same way.
So knee surgeries, out. So no knee surgeries anymore. That's your opinion.
Pregnancy, out. No one's allowed to get pregnant.
Surgeries, out. Cosmetic surgery, circumcision, out. I'm totally fine banning those.
Okay, so Ted, answer my knee surgery. So no knee surgeries.
Knee surgery is necessary. That's a problem with
not necessarily.
How do you fucking define? How do you define necessary, Ted? Ted, like again, where's your medical license?
Like necessary.
Oh,
Because a feeling in your head isn't
all
isn't a medical problem.
all antidepressants out, all antipsychotics out, all schizophrenia drugs
Well, those
out.
don't. The thing is, those don't treat the body. You're not
Do you see what you're
sterilizing and
saying?
mutilating the body.
Ted, what the fuck is a brain? A brain is part of a body, right, Ted? If you think, you know what, I'm
That
dropping your
depends if
ass.
you believe in the soul.
Wait. I got one more question.
No, I already dropped him. Sorry, I dropped him.
I was gonna ask if chemo sterilizes children when they have childhood cancer, should we just stop doing that too? Right? Like the reality is we can continually have that conversation, and that's what we were demonstrating right there, chat and everybody, is the fact that once they start giving in to the like, oh, one is too many, and then all this, now you're completely ripping out and destroying the entire medical situation. And that's what I wanted to get to. It's like, okay, great. So under Ted's rule, we're just going to go in there, rip up all medical science, all clinical science, all the whole entire theory and academia of psychology, psychiatric care. We're going to throw out everything we can't see. We're going to go back to the dark ages where we bleed people out, because that seems to be the thing that makes people's headaches go away, right? Like, we're going to go and do that and go back to prehistoric freaking times of medicine, because I can't see it. Therefore, I don't hear it exist. It's like such a childlike way of thinking. It's right, so gross.
The anti-science view that Ted has is unbelievable. And like, I got pissed off, and rightfully so, that like I've spent over a decade studying medicine and like starting to practice medicine, and I'm so inexperienced. There's a lot that I'm learning, and the fact that people think that they can not even know that the brain is a physiologic and like biologically necessary thing to keep healthy is like, they can have that view and then think that they can make medical decisions for other people. Like, absolutely fucking not.
Hey, do you think this clip just fell out of a coconut tree? No. It did. Okay, now technically I did build the channel into a coconut tree and it did fall out. And also that our internet router is up there. Actually, in a lot of ways, this production fell out of a coconut tree. But we could only afford that because people like you supported us for $5 a month. Over where is that, Eric?
Patreon.com/calltheline. And
that's right.
Jimmy will,
you got it.
Yeah, be grateful. Yeah.
We have an exclusive patron podcast over there. Check it out. Thumbs up with it, Eric. We talked about this in the meeting. We have to both.
Oh, yeah. I'm sorry. Okay, there we go.